will practice using the memory word ABCABS in a cycle of care as you learn emergency first response skills. The meaning of the memory word ABCABS is as follows. Within the AB portion of the memory word, the first A in ABCABS stands for airway. Essentially, the A reminds you to ask the question, is the patient's airway open? Also within the AB portion of the memory word, the first B in ABCABS stands for breathing. This letter reminds you to ask the question, is the patient breathing normally? In the cycle of care, you begin by initiating a very quick check of the patient, attempting to answer these two questions. Is the patient's airway open, and is he breathing normally? If the patient's airway is open but he's not breathing normally, then call emergency medical services and quickly move into the cycle of care. Within the memory word ABCABS, the CAB portion of the word reminds you how to perform CPR. Let's see how. CAB stands for chest compressions, airway open, and breathing for the patient. When a patient's not breathing normally, you must act immediately to provide chest compressions. After chest compressions, you open the patient's airway and then breathe for the patient. As defined earlier, this is how CPR is administered. After breathing for the patient, you continue to move through the cycle of care by returning back to chest compressions, opening the airway, and breathing for the patient. You continue with the cycle of care until professional help or an automated external defibrillator, AED, arrives.